Hello, good afternoon. My name is Cabrera, and I'm going to explain the physical assessment of the lymphatic system. I'm going to start the physical assessment of the lymphatic system, with inspection of the skin of the patient. We can find different change in the skin color in some disease related with the lymphatic and immunological system. After that, I'm going to start the examination with the palpation and inspection of the areas when we can find lymphatic node change, the most important lymphatic node change. Starting in the head, we are looking in the occipital area. In the base of the skull, we have to palpate with 3 fingers in a very, circular motions with slight pressure and then increasing the pressure. We have to find if there is any lymphatic node, if there is swelling or tenderness in the area. Do you feel pain?
No.
We have to check in both area of the base of the skull. After that, we're gonna check the other areas in the head when we can find lymphatic nodes. For example, in the preauricular area, we have to use 2 fingers to palpate any lymphatic nodes. Lymphatic nodes, we should not feel a very evident lymphatic node. They have to be mobile. There is no pain in a normal lymphatic node, so they should not be fixed in the area. So we have to check the preauricular area, and we are going to check the post-auricular area, looking for lymphatic nodes. Then we have to do it in both eyes, of course. Then we're going to check the parotid area, which is in the angle of the mandible. We have to check with 2 or 3 fingers. We have to check for lymphatic nodes. Then in the middle part, in the way from the parotid area to the chin, we have to check in the lateral region behind the mandible if we find a lymphatic node. In the other side of the head, of course, we have to do the same. And in the front of the head and below the chin, we have to palpate for looking for lymphatic nodes if there is swelling or there are pain or tenderness in this area. After that, I'm gonna check the area related with the neck. We have to make the inspection of the neck in the anterior region, because sometimes when a lymph node is swelling or is in a big proportion, we can see it directly looking into the skin. I'm gonna check the superficial anterior cervical area for superficial anterior lymphatic node chain and the superficial posterior lymphatic node chain of the neck in both eyes, for example. Be careful, we are palpating near the carotid artery, so we have to be very kind to avoid any problem or symptom with the patient. When we finish with the neck area, we are going to examine the supraclavicular area, which is a very important part of the physical assessment of lymphatic system, because this is an area that sometimes when we find lymph nodes in that area, it could be a manifestation of malignancy, and we are going to examine the supraclavicular area in both sides, of course, looking for any swelling, tenderness, or a palpable lymph node. Both sides. After that, we're gonna check the axillary region we are gonna ask the patient to put the hand in the head, and we are gonna palpate the axillary region, looking for lymph node change in the area if there is any swelling or tenderness at the same way. We have to do it to the other axillary region too, and we are going to look for any lymphatic node. Using the same position, we're going to check the epitrochlear region, looking for any lymphatic node. The same thing with the other part of the with the other extremity. I'm going to ask the patient to lie down in the bed to examine the inguinal area. Okay, in the inguinal area, we are going to check the superficial superior and superficial inferior inguinal lymphatic chain, looking for any lymphatic node. If there is swelling, tenderness, we have to check if there is any lymphatic node fixed in the area, which is an important sign of an important disease, of course. I have to do it in both eyes, of course. After that, I'm going to check the popliteal area, looking for lymphatic nodes in the popliteal area, and of course, if we find any node, we have to check the consistency, how big it is, if the node is fixed or is mobile, and if there is swelling or tenderness related with the lymphatic node. It is important to know that when we are assessing the lymphatic system, we have to check in the extremity for the presence of edema. We have to check if there is any edema, about the characteristic of the edema, if it's bilateral edema or if it's unilateral edema, and you know, the magnitude of the edema, because sometimes edema is an expression of lymphatic node inflammation in the abdomen or in different chains. We can cause the obstruction of the lymphatic circulation and provoke the edema in the extremity, so we have to check for edema. And as part of the lymphatic system assessment, we have to check in the abdomen the presence of enlargement of the spleen and enlargement of the liver, which can be affected if we have a disease related with the lymphatic and immunologic system. As we know, to check the abdomen, we have to follow the different steps of the abdominal examination, which are inspection, auscultation, palpation, and percussion. And in the inspection, we have to see the symmetry of the abdomen, if there is any swelling, or if there is any mass that we can see directly in the inspection of the abdomen. We're gonna auscultate the abdomen, looking for any root or murmur in the region where the spleen is located, and after that we are gonna make the palpation, looking for enlargement of the spleen or enlargement of the liver. We are gonna do it gently. To look for the enlargement of the spleen, we are gonna start palpating in the right lower quadrant, and we are going up direct through the spleen region. We can ask the patient to breathe in and breathe out, and then if there are any enlargement of the spleen, we're gonna feel in the tip of our fingers that when this movement, this respiratory movement, we're gonna find that the organ is enlarged, because we're gonna feel it with our fingers. Of course, we are gonna check. There are different maneuvers to check if there is any enlargement of the liver, and if there is any enlargement, we have to measure how many centimeters is the liver below the costal margin. And after that, we can make the percussion. In the percussion, we are going to define. We are going to define if there is an enlargement too, because normally we can percuss very easily the spleen. We are going to find normally a tympanic sound in this area, but if the spleen or the liver, if they are, if they are with some kind of inflammation, we're gonna feel a dullness sound in this area. Basically, this is the most important part of the lymphatic system assessment. My name is Cabrera. Thank you very much for the attention.